Well, hello, everyone, and welcome to CoachX Live with the Institute of Coaching. My name is Jeffrey Hull. I'm the Executive Director with the Institute of Coaching, and I am really excited to talk about wellness-centered leadership in the healthcare space, and maybe in every space, but definitely within the healthcare space, because we have an expert in the house, a thought leader, a dear friend of the Institute of Coaching, and her name is Kerri Palamara. She is a physician in the Harvard Medical School system. She's an associate professor. And Kerri and I are going to talk about the challenges that she's been working over the past few years around helping with burnout and moving the healthcare leadership system or the leadership ecosystem towards what we're calling wellness-centered leadership. And I'm going to definitely dig into what she means by that. So I want to welcome everyone here. I'm not seeing the hellos yet, but hopefully folks will start to pop in on the comments and let us know where you're coming from. And if you have a question you'd like to ask Kerri, please put it in the chat. And we'll, as soon as we start to see them, because sometimes they don't come in right away, we will try to get to as many as we can. So before I start, Kerri, I want to just give people a little background on you, because you have a very impressive background and you're very special in that you operate both within the physician space as a doctor, but also focusing on wellness and in particular coaching. So let's step back for a minute and just give folks a little bit of your background. Dr. Kerri Palamara is an associate professor, as I mentioned, at Harvard Medical School. She leads the Center for Professional Well-Being at the Department of Medicine at Mass General Hospital, which is part of the broader Mass General Brigham system, in which we at the Institute of Coaching are also an affiliate. Her academic work focuses on physician coaching and physician well-being. As I mentioned, she leads the American College of Physicians Physician Coach Training Program all across the country, which focuses on training physicians to integrate coaching techniques into their quality improvement and well-being initiatives. She has won numerous awards, teaching awards at Mass General Brigham, at Harvard Medical School, at the Society for General Internal Medicine. And she also created a coaching program, physician coaching program, in conjunction with the Institute of Coaching a few years ago, to improve physician awareness of their growth and development, reduce burnout, enhance resilience. And that program has not only won awards and been published in prestigious journals, but also has been replicated all across the country. In fact, I think, Kerri, you can probably tell us where they're doing programs similar to this, because I know that there are many hospitals that have taken this up. So I'm now seeing folks coming in. So welcome everyone from Texas and Indiana and New Mexico. Oh, Nederland, Colorado. That's interesting. I thought it was going to be Netherlands, which is where Anyway, it's a pleasure to have you here. And I want to step back and get you to give us a little history, because you've been doing coaching in the healthcare space with physician leaders for quite a few years. And I think it would be interesting for the audience to hear a little bit about how you as a physician even got interested in coaching. Like, what led you to care about well-being and all of these topics that I think are really front and center today, even before the pandemic?
Yeah, I'm so excited to be here. So thank you for having me. And, I came, now that I am now a certified coach, and I consider myself, as someone who has a lot of experience in coaching in physicians. But when I came to coaching, it was from a very novice place. And by that, I mean, I was looking to create a program as a medical educator to help support our trainees, our residents, and our fellows along their journey of development, and recognizing that we were teaching them, but we weren't really developing them or helping them develop themselves. And I knew, like, we're such an amazing hospital. We're one of the best residency programs in the country. Like, shouldn't we be the best at that too? And so I had no idea what I was really trying to build. I didn't know it was coaching. And so like I started off with Google being like, what does this mean? This thing I'm trying to build. And coaching kept coming up. And I was like, I think I'm talking about coaching. But I had only ever really known like sports coaching, like whistle and clipboard kind of
Right,
coaching.
of course.
And so I had to like kind of learn how and in what ways this was different. And the more I read, I was like, yes, this is it. This is the thing. This is what I am looking to build. But also recognized I was way outside of my depth here. And I needed help to figure out like I can build programs and I can run research studies, but to educate people to do this thing that was really different than mentoring and really different than what we pride ourselves in doing in medical education, like teaching, mentoring, advising. I knew it was really different, which meant we not only had to teach people new skills, but we kind of had to like learn skills to teach them to communicate with trainees in a different way. And I should back up because you could also say like, all right, so why didn't you just hire a bunch of coaches to do this? Like outsource it to people who are experts in the field. I had no money. I had no money and there was a mandate to do something with $0, and which is always the best. And I also with a secondary goal of mine was how can we get the faculty more engaged? Like we're a really big place. Like how do you build something internally that will bring people in and connect people with each other? So we had this idea, like what if the faculty could be the coaches and we could teach them how to do that and then pair them up to work with trainees in a safe space for their development. But recognize that educational part was something I needed a lot of help with. And so that is when I was fortunate enough to connect with Carol Kaufman, who helped me with designing the curriculum, who helped me with thinking about how we wanted to, like what principles were we really looking to instill in this, what then together we would kind of talk it through and figure out, okay, so then what do physicians really need to learn and unlearn to be able to do this? And what Carol really believed in the concept because a lot of people in the coaching world were not thrilled about me doing something that was not certified coaching. And we really recognized like we had to start from scratch. We had to start from somewhere because this need was so great. And so we also recognized then we would have to study it and disseminate it and get that work out there. So Carol and I worked for years on the curriculum design, the coaching, the training, the evaluation, the dissemination. And then over time, she kept saying like, you should really become a coach. And then I did. And over years, I built up my own independence with the curriculum and the training. So now I manage that part of it as well. And this program we've been able to disseminate to over 50 residency and fellowship programs around the country, as well as several professional societies. And so the model that was designed is one that like it follows a structure and a formula so that doctors who don't know a lot about coaching but really have a desire to learn and actually know more than they give themselves credit for like motivational interviewing and asking open-ended questions. Once you can help them get out of advice giving mode and out of expert mode and into like, you are the driver, I am just the vehicle kind of coaching, we could really do a lot. And so we had some great studies where we were able to show decreased burnout, decreased emotional exhaustion, improved engagement, professional fulfillment, gratitude, coping, intolerance of uncertainty, like incredible outcomes over the years in all these dissemination studies. But as this grew, I recognized that one pilot that failed that I tried was when you taught faculty the same, you taught attendings the same skills you taught them to work with a resident, but then asked them to work with another faculty member. And there was something
physician
about
to physician was problematic.
physician to, in that it was a really nice cup of coffee, but it wasn't coaching. It was not coaching. They needed deeper skills because it was too close. It was like too easy to be like, oh my gosh, me too. And you're like, that's not coaching. And so recognizing that we needed to build deeper skills for faculty to be able to be supported because faculty needed coaching too. And so over time was able to get an investment to be able to send faculty to become certified coaches who now are able to work with other attending physicians. And what's beautiful now is we have faculty who are really engaged in what I would call novice coaching of trainees, where they have coaching skills and have been able to show in other studies that they're not just using it with the person I assign them to use it to, but they're using them with patients and family members and other
Wow.
learners. So it
Skill
really
heavier,
disseminates.
right?
Yeah, it's a really transferable skill. So we have that all the way to these certified coaches being able to do one-on-one coaching and group coaching and facilitated listening sessions and retreats and leadership coaching. And so really amazing to see the way the spectrum of coaching skills can be applied from novice to advanced to support a population of clinicians. And it's no longer just physicians. It's throughout the clinicians in our system.
Wow. So that leads me to two kind of core questions, which is number one, how did you convince physicians to take coaching seriously in the first place? Like, I don't think nurses and physicians are generally trained to think about that mindset that they need coaching or that they should become coaches. So I'm curious how
Yes.
you've seen that evolve. And number two, what is wellness-centered leadership and how did that emerge out of your work?
So it's actually a very organic tale. But in the beginning, it was hard, Jeff, because there was no data about coaching. And that really like got me revved up. I was like, oh, there's no data about coaching. Like, I'll get you data about coaching. And so,
We'll create
um,
some data about
yeah,
coaching.
I'll do it. So in the beginning, it was a little bit like, trust me. And I think the fact that I didn't bring in people from the outside was very important when I started, because
Ah,
a resident meeting with an attending isn't that weird. They do that for mentoring, they do that for advising. So why not just have another meeting? And this one's just for you. It's just for your needs. It's just for what, you might, your own development. Like, there's no evaluation here. And so they could kind of lean into that. And we started with faculty who we knew might be early adopters and be excited about it, because we scaled up. So initially I just needed 26 coaches my first year. And I was like, I can find 26 faculty member who are willing to try something for me. And I used my social capital and, I hit the streets and
were
I
they
explained to
mostly in
people what it
internal
was.
medicine?
Initially, it was internal medicine. Now it covers 10 different departments in the hospital, but initially it was internal medicine. And then the data began to speak for itself. But I also knew in professional societies when I was presenting, like if I would go to my annual society meeting for internal medicine or for educators and just started talking about how everybody should do coaching, they'd be like, no, thanks. Um, so what I did in the beginning is I paired up with someone who did a lot of work on remediation, and educators love remediation. So we did a workshop comparing and contrasting remediation and coaching and how they're different. And people were like, "Oh, this is
Oh,
interesting. Tell
okay.
me more about coaching." And then the next time I talked about what is coaching. And then the next time it was like, "Here's how you could do coaching." So I kind of like gently prodded people toward the concept, but didn't really force it on anybody. And by then collected data along the way so I could say like, actually, I have outcomes here. Um, and then what is great too is that with these outcomes and with these skills, recognizing that the other thing that started to feel icky to some physicians was like, there's burnout and you just need to be better. You just need to handle your stress better. You just need to feel
It's all
better. Yes.
self-focused. Yeah, you don't need help from someone else, right?
Right. But the fact that we're saying everybody's doing this and actually it's just making all of us better and this culture better, and that we're learning from what you're telling us so that we can change how we do things. So if everybody keeps complaining about a rotation in coaching, we need to think about that rotation and how it's broken. Or if everybody keeps complaining about a problem in the system, we need to focus on the problem in the system. So having it be a system-wide intervention allowed us to help individuals, but use the basic info we're hearing from them to actually drive change on the systems level. So that built a lot of trust as well, so that we could share with people how we were using this information, what it was doing to support them.
Wow.
And that would build from there. And that right there is a great example of wellness-centered leadership. Or I'm even leaning a little bit more into this concept of well-being centered leadership,
Okay.
specifically to get away from this, like, you're the problem, self-help approach, and really
Okay.
thinking,
Interesting.
we're a culture of it's, you know what the problem is between wellness centered and well-being centered is just a second hyphen in a name. Uh, if only there was one less hyphen, we'd use it more often. But the well-being centered leadership basically is suggesting that the culture of a system is determined by the leaders of the system.
Right.
And if leaders are able to adopt the culture of well-being and really infuse that into how they think about how systems support people, but also how people are a part of these systems and how they are the example and how they interact one-on-one and across an entire system will impact how everyone within that system experiences it, how they work with each other, and what their quality of life at work looks like. And so it's a lot about focusing on if you focus on the leaders and how they are making decisions, keeping humans at the center of all of that, and concepts that support humans and their well-being and ability to thrive, that the way we communicate change, the way we engage in change, and the way people experience change will be completely different.
Wow. And are you finding that at least in the hospital systems that you're engaged in, that there has been a transition, like that the physicians and the leaders are actually open to this? They're beginning to come around and actually consider well-being, as you say, to be key to their success, but also to the success of not just their patients. I mean, it's ironic because, of course,
Yeah.
they're focused externally on the wellness or the well-being of their patients. They always have been, right? But they don't historically have a mindset, and they're not trained to think about themselves
Right.
or the system in which they operate, which is what led to so much burnout.
Absolutely. And recognizing like so many organizations are like, we're a patient-centered organization. But then that means that you're like making decisions that might be actually on the backs of all the people taking care of those patients. And so transitioning to like a human-centered organization where the organization cares for all of the humans who are taking care of all of the humans, then the most amazing care can be provided and people can feel wonderful about the work that they're doing and connected to their meaning and purpose and all of those things that we read about as like aspirational can actually be role modeled by leaders and really included in how they make decisions. I think that some leaders are really into this. They're like, tell me how I can do this differently. I think not everybody loves being changed. And there are some people who feel like this is just like, I
That's
don't
an
have time.
understatement, I think, probably, right?
I don't have time for this, or, this is important. Most people believe this is important, but perhaps not as important about some other thing they may need to do. Or if I listen to every person's perspective, I'll never have any time to do anything. And that's actually false thinking. That's actually not what well-being centered leadership. You don't have to go around a boardroom of 100 people and be like, but tell me how you're feeling. It's
Right.
really about considering how people might be feeling, anticipating that, really communicating for that and incorporating that into either how decisions are made or how decisions are transmitted or carried out, like how change is actually carried out, allowing people to have the opportunity for feedback. Like there's so many small ways that with time you can show leaders like you don't need to change as an individual. It's really changing how you work with other people and think about it. Honestly, so much of it is just thinking, like empathy and thinking about how other people might be reacting or can even considering that.
Wow.
There's a lot of appetite for this.
That's I guess the question is that, there's an appetite for this outside of the healthcare system. I think a lot of companies and organizations have started to really think about the well-being coming out of the pandemic. They had the wake-up call. It's like, if my people are not taking care of themselves, I cannot have high productivity. I cannot have innovation. I cannot have creativity, because human beings need to take care of themselves in order to be high performing, in order to thrive.
Yes.
And it's interesting to see the healthcare system, which is one of the places during the pandemic where things got really painful. And coming out of that, are you seeing that there is a real revolution in the space around the way physician leaders and nurse leaders think of their role as part of an ecosystem of well-being?
I think we are at the beginning. I don't think we are in
We're
the
not quite.
middle of so, because I think a lot of people are like, this is important to sort of like early stages of change. Like everything you just said is important. And so let's throw services at them. Let's throw supports. And then it's like, oh, this is expensive. I don't know if we can do this. And don't actually think about really changing structurally how decisions are made, how humans are factored into those decisions, and think that if we just support people on paper better, that will support that will translate into all of this experience happening. But actually saying like, you don't need to add more. Like, what could you take off of people's plates? Which again includes like anticipating, hearing from people, empathy, all of these concepts that cost nothing. This costs nothing. And so really helping people to see that it's not about pushing services, but taking away and really helping people feel seen and heard and valued and appreciated in the workplace. I think that there are a lot of places that have like assigned people to care about this and have given those people budget to do things. Like you hear about chief wellness officers and wellness committees and other things. And that is an important start, provided that they are real jobs, that they are real roles where that person does actually have a voice, where all important decisions are made, and that they are their input is heard, but also that they have the opportunity to educate those around them so that they don't always have to be at that table.
And I think one of the things that you've done in your work is integrate coaching into what the physician leaders actually do. And they get coaching as residents, and they become coaches, so that it's not so alien to them once they're in a leadership role, to see that what they're doing is wellness centered by doing less, right? It's not it doesn't have to be a program. It has to be a way of showing up.
Yes, 100%. And I think that I noticed there's a question about the role modeling. Like,
yeah, Joyce is asking you to speak about role modeling.
Yeah, like so much of it is how you show up and how you are. Like even just on my way up here to get in front of the computer, I had a patient. I was saying to Jeff, I had a patient who was like a little bit sicker than I expected, a little bit later than I expected, and I'm like running around and all over the place. And I finally just looked at one of my medical assistants and I was like, I need to slow down. Like I'm actually not getting there any faster by rushing around. And it was like that moment of like reframe, reflect, be present, be focused, and then let's get this patient what they need and move on to the next thing. And there's so much about, what time you're sending emails, how you, so many times when people say like, oh, that meeting was so frustrated, all they did was talk at us. Like, how do you listen? How do you show that you are listening? How do you show that you've actually incorporated feedback so that people feel heard? How are you investing? How are you communicating publicly as well as one-on-one? Like, it's not just, I think it's important to take care of yourself. I think it's important to talk about that and normalize that as a good thing and not be this like hero for taking terrible care of yourself. I think it's really important to do all of those things and be open about that and how you prioritize. But it's also how you create the constructs for other people to be in that. And so much of it true is like also is how you cultivate trust within your organization. And if you become a leader they can trust, that ripple effect is huge. So role modeling, being trustworthy, and role modeling being someone who appreciates that in others, I think is just really important, much more so than like, how do you spend your time when you're not at work? Really, how are you treating people and engaging with people when you are there? Like, how curious are you? And, things like that.
Yeah, it's really more about well-being in the moment, not just well-being
Yes.
on my calendar.
Yes. Because honestly, well-being on your calendar could be exhausting sometimes.
Yeah, you can add, it's like
things.
people who want to add meditation to their day, and then they realize they don't have time to meditate. And it's because, they could have meditated while they were doing the dishes, as the old adage says, but they think of it as an added to-do list.
Yes.
So that's the kind of role modeling. And that's what I think is really powerful about what you're doing with bringing coaching right into the space directly, so that it becomes normalized. That the physicians and the leaders in general see themselves as coaches, whether they're with their patient, whether they're with a junior physician or a mentor, a resident. It just becomes part of their normal way of being. It doesn't add to their plate.
Yes, exactly. And in that way, it is, and I know Margaret Moore has talked about this a lot, like in that way, it is truly transformative.
Right.
So I guess I'm a liar when I say I'm not trying to change people, but I think there's like you need to change versus like, wouldn't it be amazing to transform into this kind of person? And where it's like aspirational as opposed to like remediation.
I totally agree. It's so powerful and it's so much needed. I mean, given that where we are in a healthcare system that is replete with a lot of burnout and people feeling like, why did I get into this in the first place?
Yeah.
And so it is truly culturally transformative.
And I am a big fan of like simple statements to kind of guide our work, whether that be a vision or just like a sort of framework. But the one statement that has stuck with me is that systems change at the pace of relationships, and relationships build at the pace of trust. And so, trust really being at the core of developing relationships, and developing relationships is the way to transform a system.
I love that. And the irony, it strikes me, having done a lot of coaching myself with physician leaders and a lot of systems, is that healthcare systems, is that when I talk to the doctors about what they do every day with their patients, they are role modeling their interaction with they care, they have empathy, they're listening. What they do in the patient space is just needs to be translated into the leadership space.
Yes.
Right?
Yes. And I think that's the human centered part of it right there, is that recognizing the humans that are a part of that system. And like, you can't possibly account for every single person's point of view, but you can try to consider that. Or even like a great example is if you're going to do something that you know is unpopular or is going to be really damaged, like a system for every positive change, there might be somebody negatively affected. Like, how
Right.
can you actually get to those people and give them a heads up, engage with them and understand what that might mean for them? How could you, are there other things we haven't thought of? Like, so how many times have you heard, like, if they only asked me, I could have shared all these ideas that I had. And so I don't want to be naive in recognizing that these massive systems are complicated, but treating people like humans is something that can be really simple, but it takes intentionality, and it takes a desire to be that kind of leader.
Right. And it starts with recognizing that just as you see your patient as a human, you should see your colleague as a human. You should
Yeah.
see it, right? I mean, it's, as you said, it starts with the central premise of who's across from you, and
Yes.
empathy, listening, trust, not just with the patients, but also with your colleagues and with
And
your.
and I bet there are a lot of people, a lot of leaders who are like, "I thought I was doing that." Like, I'm not doing that. And I think that's a great example of coaching can be so helpful, and getting like 360 feedback and using different tools. Like I saw Jennifer Feldman on here. She has this like amazing tool where you can get 360 feedback for leadership, and with a positive psychology lens, like strength-based lens. Like, there's so many ways where you can really learn from people. How can I be better? How can I transform? But again, and you need that space and that intentionality to do it. And it's hard to slow down time and try to focus on this, but it's not impossible.
Do you think we're going to run out of time, and I could ask you so many questions? And there's a question that came up about supervision. Do you just want to comment on that?
Oh, let me see.
Yeah, I've lost her name in the, but
So as part of my this must be free mandate, the
Alice, right?
the trainee coaching does not include supervision. We have check-ins and drop-ins with the coaches where they can practice, they can ask questions, and but we don't directly supervise their coaching. We also check in, like we recognize that a lot of trainees vote with their feet. So if we notice that somebody's not meeting with their coach, I reach out and say, like, probably one of three things is true. You're just super busy. And if that's the case, like, think about trying to squeeze this in, even like a half hour. It's not going well with your coach, in which case I'll give you another one. Just let me know. I have plenty to choose from. Or you're just not that into coaching. And might I grab a cup of coffee with you and convince you why you should? But as you can see, all roads still lead to coaching. But so that's how we manage it with the trainee. We're not ideal, but it's like we're doing the best that we can with this resource. For our faculty coaches who are certified coaches, as part of their certification, they receive supervision.
Yeah, and what you're doing, it has a supervisory component to it, right? I mean, you're tracking. That's really the key, is giving
that's
people
true.
access. Yeah.
And measuring outcomes.
Which is amazing. So you can continue to write about the value of these programs and collect data, which is what the physicians that are new to this will often ask you for. So.
Oh, yeah, and because especially the people who are like hard science people who don't want to necessarily buy into something that feels softer. When I can sit there and be like, I could show you a 48% reduction in burnout, and they're like, wait, what? So to be able to speak to that, randomized control trial and other type of language it's important academic currency.
That's great. So I think Damie is asking a really good ending question, and we'll take 1 minute because we're going to run out of time. Is what is the first step that you would take to create a well-being centered leadership agent of change within the system?
So that is a great question.
And you have less than 1 minute to answer.
I know. I wonder if an opportunity to you may not be able to get right in front of the C-suite right away, but if there was an opportunity to start a pilot within your local environment, within an organization, if you are internal, like within a department or a division, and just running even like a workshop about these principles, and then suggesting others do it as well. So kind of building from the local unit out and broader. That's definitely what we're doing right now. If you are outside, if you can get a grand rounds, if you can get offer a free consultation or something where you are able to get in front of a group of people and then have them vouch for you, that may be one way to come in from the outside. But you're right, and a lot of people don't want to trust the outside right now, or can't afford to, or something else. So if there is a way to get your foot in the door by offering like a free workshop or free something, or finding out who, if you're an external agent of change, who might be your internal champion that you could collaborate with.
I love that. I think finding the champions, right? And you don't need a lot of them, but you do need a few key people that you can coalesce and form, in a sense, a club to start to spread the word, which is what we're doing by having you come on this show, is spreading the word that, the Institute of Coaching is certainly committed to expanding the opportunities for coaches in the healthcare space and in general around well-being. And I just want to remind everyone, or let everyone know, that we are going to have you do a seminar for us on becoming a well-being coach towards wellness-centered or well-being centered leadership in healthcare, but maybe not just in healthcare. I think it applies across organizations.
Absolutely.
So we are super excited. Look on our website, learn more about it, and you'll get an opportunity to interact more deeply with Kerri and learn from her, because she has an amazing story and history and knowledge about how to bring these transformations into the systems that need them desperately. So we look forward to that. We thank everyone for joining us today. Thank you, Kerri, for taking the time. We'll let you go back to your patients, and we'll see you soon.
Thank you so much.
All right. Thank you, everyone. We'll see you next time. Take care.